Hey guys, Dr. Benjamin here, kicking off a new YouTube series. These are the top 10 things that are no-goes, meaning things that you should not do after your cosmetic surgery. All right guys, top 10 no-goes for post-op BBL edition. So number one is pretty obvious. If you've had a BBL, absolutely you shouldn't be sitting on it. You know, it takes a good 3 to 6 weeks for that fat to get a blood supply. So what I usually recommend patients do is use a BBL pillow or a pregnancy pillow. Essentially, it's a pillow that sits either on the back of your thighs so that your butt kind of hangs out the back, or a little hole in the middle of that pillow so that your butt can touch either the mattress or the seat, but you just don't want the direct pressure there. So I usually recommend using those. You can actually lay on your back, after you've had surgery. You just need about 6 pillows above your butt and below your butt, so be cognizant of the pressure on that butt itself. Number 2 is skipping out on the compression garment. And I can't tell you how many times I've seen this. Either the patients are wearing garments that are too tight or too loose. And guys, the post-op for liposuction BBL is more important than anything I do in the operating room. So typically we'll give you a faja or a compression garment with some foam to help smoothen out that skin so that you don't end up with all these wrinkles all over the place. It's super important to wear that all the time unless you take it off to shower. Typically, you want to be out of it for no more than about 60 minutes because you're going to swell out. It's going to be hard to put that thing back on. And then remember, it needs readjustment. So as your swelling comes down, typically by the second or third week, you may need an abdominal binder or a different faja. But typically these fajas have different levels of compression, so you don't have to be in the same line throughout. You gotta tighten it as you go every single day. Number 3, expecting all that fat that I put in your butt to survive 100%. That is a no-go. Remember, you're gonna lose a good 25-30% of the fat simply in the transfer alone. Your body's gonna reabsorb that fat, it's gonna liquefy. So you're not gonna get 100% of it. So that also means that the next day after surgery, your butt's gonna look huge, and that's totally normal. It's gonna look massive at the beginning. As the swelling calms down, as some of that fat gets reabsorbed, again, it's like hitting target. You wanna get it just right. So be prepared to lose some of that fat. And remember, it's always easy to add more than it is to remove later on. Number 4 no-go after post-op, in a BBL, ignoring your protein and hydration. Guys, this is not the time to get on Ozempic. This is not the time to lose weight. After you've had surgery, your body's in a catabolic state. You gotta feed it to heal. So protein, protein, protein. Small frequent meals. It's super common to lose your appetite after a large volume liposuction case, but you gotta push yourself to be eating small aliquots, and of course, have that big jug of water because you're gonna be super dehydrated even though you don't feel like it. So you gotta be chugging water. Protein and nutrition, super important. Number 5 no-go is flying or taking long car rides immediately after surgery. And that is a no-go. I get patients from out of town all the time, out of state even. Typically, I mandate that those patients be in town for at least a week and 7 days, and that's typically when I remove my drains from the liposuction cases that I do. You want to make sure that you get that moving around. If you are in a car every hour or so, if you're on a plane every hour or so, get up, walk around, get that blood circulating. Decrease the chances of any blood clots after surgery. Number 6 no-go is choosing volume over proportion. Again, BBLs have changed. Even the aesthetic, tastes have changed. Typically, I like a more classical look, something that matches with your body. The big Kim Kardashian butts, of the past, that style's really gone away. And the problem is a lot of patients are trying to reverse that now, and it's really difficult to reverse. And so remember, the fat should be strategically placed. Now, some patients have massive weight loss with Ozempic or bariatric surgery, and they need the larger volumes. So it's really dependent on your body. So don't look at your friend and say, that's what I want, because it may not fit your frame. Number 7 no-go post-op BBL is neglecting post-op movement or not doing your early ambulation. Yes, you just had surgery. Yes, rest is important. But at the same time, I see all my patients the next day, which means you need to be able to walk into my office. You need to be able to walk out of my office. You got to be able to get to the bathroom by yourself. Assistance is okay, but you got to be moving around. That blood's got to be getting everywhere. Circulation is super important. So this is not an excuse to be laying in bed, because that's a surefire way to end up with a complication. Number 8 no-go is doing BBL workouts way too early. Now, if you've healed, it usually takes 6 weeks for that acute phase of healing. You'll still be swollen. But after 3 weeks, if patients are doing really well, actually let them do aerobic activity, jogging, using an elliptical, walking on a treadmill. But you should be at a pace where you can hold a conversation. If you do things too early, you're increasing your blood pressure, increasing your risk of hematoma, increasing risks of just complications happening in general. So you got to pace yourself. It's a balance between not doing anything and doing too much in the post-op period. Number 9 no-go, and this is an interesting one, but I get this every now and again, sitting in hot tubs, pools, or saunas. Now this is okay after 6 weeks, but during those first 6 weeks, your body's still in that healing phase. Even the skin itself hasn't completely closed, and even if those incisions are super small, if you're sitting in pool water, we don't know what kind of bacteria is in that water. You're going to increase your risk of wound infection, especially that incision that we use to put the fat into the butt. You're increasing your risk of BBL infections, and those can be catastrophic. Patients get super sick from those. So make sure you hold off on the saunas, the hot tubs for at least 6 weeks after surgery. And of course, number 10, I'd say this is probably the most important, is choosing your surgeon based on price alone, and that is an absolute no-go. Remember guys, this is the one surgical procedure in plastic surgery that has one of the highest and deadly complication rates. So you really got to go to someone who knows what they're doing, who does a high volume of these, who's a board certified plastic surgeon, and he's doing the surgery in an accredited surgery center that is able to handle and take care of these patients. It's a very specialized kind of surgery. High volume liposuction is transforming more than any other procedure that we do in terms of body contouring, but it needs to be done safely and in the hands of someone who's well experienced.